Welcome to On the Couch,
where we talk and you listen.
or at least we think you should.
I think so.
So today on episode 3,
Number
3, yeah, we thought, because we go off basis, our conversations based off life and how it happens to us as we go.
Yes.
So we had a very interesting conversation earlier this week about the joys of womanhood.
Yeah. Oh, there's so many.
There is the
There's
joys
so many.
of being a girl. And so, we thought we'd discuss that a little bit today and our take on what it's like being a girl.
Yeah.
Because, we were girls at one time.
Yeah. We're very experienced. We're very experienced at being a girl.
Yeah, I guess.
It's the only thing I know, really.
So, when you were little,
Yes.
when you're little, you get to wear pretty dresses and frilly socks and little shoes that are all cute.
Tutus.
Yeah.
Ruffly things.
And it's perfectly normal. It's perfectly okay for you to wear a tutu. I really
Yeah.
don't understand why it's not okay for me to wear a tutu now in everyday life. But, yeah whatever.
I mean, we did have that one time, Halloween.
Yeah, that was a special occasion.
Yeah, I forgot I had it on. I wore it in the Casey's and I got a few looks. I look cute in my tutu. It's red and everything.
Red. I know. With
So,
the socks, the blue and red striped socks.
Yeah,
Those are great.
might have been the pigtails and the face
The
makeup
little-
with the
the
little
little
dot on my
nose.
nose.
Maybe.
I looked cute.
Maybe that was it.
Maybe.
But then, you get to teenage years or your pre-teenage years.
Preteens.
And you go through that awkward stage where nothing looks right. And I don't know about anybody else. I'm sure you have them too. But there are those pictures out there that you never want to see the light of day again.
Usually middle school.
Yes. I
Yeah.
had like a poodle do. Was awful. I don't know why anybody would do that to me.
Yeah,
It's terrible.
see, anything late 80s, early 90s, we should just,
Skip it.
skip it.
I don't know. It's coming back.
I-
We would have been height of fashion.
All right.
I'm just
I'm
saying.
going to say, I got a perm, so look at that. But yeah, that and it's funny because acne occurs, especially when it's picture day or the hair doesn't do right. Like you can have a perfect hair day and then picture day and you show up and it rained on the way to school and so you got wet or the wind blew and it's crooked or whatever. So at least that was my thing.
No, I just had a bad haircut.
I bad thing. I tried to trim my bangs one time. Dad opens the bathroom door, hits it day before picture day. I have the picture somewhere. We won't find it. And instead of having bangs, I have this poof up thing because they were sloped.
Did
like
you got the little short ones?
They were short at an angle. It was so bad. It was so bad. And I had to wear it like that because
Were you imagining like flock of seagulls? What were you doing where it was all like God.
I wasn't flock of seagulls, thank you very much. I just tried to work them up into my pompadour thing that we did in the late 80s with the big, but you
yeah.
could see it. It was very obvious. It's like all the hair's going back really cute. And then there's like this weird funky line like in the front of it. And I always wore some little fringy bangs. And then all of a sudden it's like, nope, forehead. There you go. Enjoy. So that was fun. Purple sweater, bright purple sweater. Because that's what Mom said I was wearing for picture day.
Yeah. I mean, I don't, when does it stop being like, oh, you get to wear cute little ruffly, frilly things or the dresses with the bells, on the undercoat thing.
Yeah.
And then you become like middle school age and it's like awkward city.
Yeah, I think it's middle school. And then high school, you're just trying to fit in and figure out which clique that you fit in.
Oh, I was cool in high school, so it's fine.
So
Not really. So
Yeah.
I really wasn't cool in high school. I mean, I had my own group of friends. It was fine. I dated basketball players, all that good kind of stuff.
Yeah.
But,
I didn't do the dating in the high school.
I wouldn't say I was the most popular person in school. I kind of kept to myself.
I went to 4 different high schools. And
I just went to
so,
one.
yeah, so I didn't have like a group that I naturally fit in because second high school was in North Carolina from Cleveland, Ohio area.
Nice.
So yeah, totally didn't fit in anywhere there because I didn't have the right accent. And so nobody could figure out where to put me. So I just hung out with anybody that would talk to me. Like, you talk to me, I talk to you. Cool, we're friends. And then went to Circleville. And I was at Circleville. So we went from North Carolina
To Circleville.
to Circleville. So a rural, smaller community. Not exactly the big school that I went to in Northern Ohio or the North Carolina school. And totally didn't fit in there either anywhere. And I was just like, you know what? I'm just graduating. Let's just get through this thing of high
Then
school.
you can be done.
And then I can go into my adult life, whatever that's going to look like. That's where I kind of decided at age of 17. I think I've been old all my life. I think that's part of it.
You're an old soul.
I'm an
That's
old
what-
soul.
You're an old soul.
Right.
You shouldn't say you've been old. You're just an old soul.
No, I've been old all my life. I've been old. Long time.
Well, you know, I don't know about you, but like teenage years were great. I mean, other than the normal thing for girls, like, you know, you got your menstrual cycle.
Oh, did your mom tell you about yours? Because I didn't get a lot of
Yes.
information.
Yes,
I thought I was dying.
she did. Oh, well,
Thank you, school, for telling me some things.
thought you
But
were bleeding out.
I thought I was possibly dying. Because, one, like in our conversation, 4 to 5 days. Nope. Nope, that's not how it was initially, which I guess is not the
It's
norm.
not uncommon.
Yeah,
Yeah.
you know, but yeah, so on day 7, I'm like, I'm dying. I'm just dying. And
I feel that way now as an adult.
and so,
Just dying.
But and it didn't help. I was at a wedding. I was 13. You know, like being a girl's great, like the first 10-ish years, you know, you get to be cute, you get to, and then it becomes, don't know when things are going to happen, when Flo's going to show up. Don't know when that's going to happen. I got to pay attention to what clothes I wear because, you know, white and whatever. And the products that were out there when we were younger were not as reliable
right.
as the products that are available now. So you're welcome, because our age group are the ones that probably went and we don't want to deal with this anymore and made them better. But yeah, like there was always like, oh, can't wear anything tight fitting, can't wear anything light colored. And so it was not a good time.
No.
And
no.
nobody shared anything about like the perimenopause. Like I knew about hot flashes, but nobody told me about
I'm
the
glad you did.
perimenopause. Like, wait, there's a practice? I didn't know we get to practice. Like, I knew we had training bras, but I didn't know we had training menopause. Like, who's training that? I didn't sign up for that.
Well, and I think the thing is, you go from, you know, teenage girl,
yeah,
and then you go to mom. You don't get to be a girl after you become a mom. You're just mom.
yeah,
Like you lose being a girl. I tell my kids all the time, I was a girl once
right.
back
And
in
then
the
I
day.
became a mom.
Way back in the day. Which comes along with its own set of issues. Like who decide? I mean, I get it. Eve ate the apple. She was wrong. She was bad. She was bad. Like I get it.
Yeah,
But seriously, that's the punishment. Like, dude,
it seems
that was a little
unfair.
harsh.
Yeah,
It's a little harsh. I'm just saying.
you and God gonna have words? Is that what?
No, I'm just saying it was a little harsh because I mean, you think about it, right? We grow the child,
Yes.
and not only do we grow the child sits on our insides. It does acrobats on your bladder.
Little dances.
Yeah, kicks you in the rib cage.
Yeah.
Some cases it tries to kill you, like
Tries
Jesse
to
tried to
kill you.
kill me.
Yeah.
But I mean, honestly, your back hurts, your hands swell, your feet swell, your face swells.
Uh-huh.
You carry around this watermelon in the front.
Yeah.
You
You can't-
waddle,
You can't eat anything,
right?
but yet, you know, and then you get to the phase that where you want to eat everything.
Mm-hmm.
But yeah, so there's no happy medium
Right.
ever.
You waddle. Like,
with
who decided waddle?
Pregnancy number 1, nauseous all the time. Never threw up, nauseous all the time. Pregnancy number 2, threw up every day at between 2 and 3 o'clock every day at work. And people would come in, and the one lady she apparently was on the same pee schedule I was, and she would come in and she's like, "Oh, are you okay?" I'm like, "It's me." And she's like, "Oh, that's right, it's 2 o'clock." Like she knew We would like have our little
my-
banter in the
It's
bathroom.
my throw up time. Excuse me,
it's
I've
my
got to go
throw up
vomit.
Yeah. For the
Um,
first 4 months, like they're like
and see,
she didn't understand trimesters. Like it's 3 months and then you stop, not 4. So
I mean, I get the fact that, you know, I get it. God doesn't make mistakes, but seriously, you could have had some sympathy, some sympathy. I'm just saying, some sympathy. And then you have the baby, and you
Mhm.
know, I don't know about you, but when I was pregnant with both of my children, the older women, not mom's age, like grandma's age,
yeah.
they would come up and they all want to pat your belly. Like, I don't know why that's a thing.
When did that become okay?
I don't know, but they all want to pat your belly. And then they say, "Oh, you won't remember the pain." Oh, no,
I
I
remember.
remember the pain.
I
I
recall.
remember all the pain.
I recall it all. Yes.
Yes, it was terrible.
Yeah. Oh,
It was terrible.
the back labor, that's
Mm.
that for me, that was the worst with the first one. See, the second one, there wasn't as much pain because she was a scheduled C-section because we went to emergency section on the first go around. So the second go around, I'm like, I don't get a trophy or, you know, you're not discounting my hospital stay. So we're not doing that whole VBAC thing. We'll just, her birthday's on this day. I'll see you in the operating room. So hers was less pain, but first one, 26 hours.
Oh,
And then they're like, oh,
my first one was,
I think we're going to have
what,
to do a
19?
C-section.
I think it was 19 hours, but I had an epidural and I had drugs, so it's fine.
Yeah, I still remember the stuff pre-drug. Drugs
Yeah.
were off. And then Travis said, you're going to have to give her more before you take her to the operating room because she's not happy because I apparently was using my angry words.
Oh, did you bring your outside words inside?
I brought, you know, jerk face and yeah.
Oh,
So yes.
Church outside words.
Yeah, my church outside
Yeah,
words.
there you go. Yeah. Church outside words. I love that.
I haven't used the other kind of words since, you know, like
And again,
pre-salvation in middle
Yeah.
school
middle school.
when I thought that was cool.
Yeah, well, like I said, my second one tried to kill me.
Yes.
You know, he
Yes, he did.
he tried to kill me and himself.
Yeah.
I don't know why he thought that was a good idea.
Yeah.
But he's fine. Just
Yeah.
yeah. He's
Everything turned out okay.
Yeah. He's
Pregnancy
an
was rough
adult-like
though at the
child.
end.
Yes. And then after you have the babies, you go back to before. So you go back to having your menstrual cycle and your 7 days of cramps and your back aches and your chest aches and your
I had leg pain, like debilitating, like day 1, walking sucked. Like and it's not like you can call off 12 days a year on sorry, I'm calling off on account of flow. Like
Right.
you can't do that. You have to go to work. You have to
Right.
do life.
right.
You know, it keeps going. The babies still want to eat every, you know, couple hours when they're first born. Like you still have to do all the things. And it's just you learn to live with it or you figure out the things that work for you. Like
Right.
everyone
Heating pads.
yeah, everyone's like, "Oh, you should use a heating pad. You should take, you know,
Midol.
ibuprofen, Motrin,
Right.
like all the things." I'm like, I'm not a huge medication person. So I'm like, I don't want to do
Drink
that.
more water.
Yeah. Oh,
Drink warm water.
yeah. Tea.
I've been told
you
that.
should drink
Tea.
decaffeinated tea because you're nursing
Yeah.
and you don't want to get the baby, you know, all hyped up on your caffeine.
On the caffeine.
Yeah. Which I you know, the one thing that I liked about pregnancy was, you know, I enjoyed the initial feels like that 9 months. 9 months, okay, tapping out. Like who do I tap to be done? Because that's when it got miserable. But
Right.
I enjoyed the feeling, the
Yeah.
babies and stuff, and I knew they were safe.
The
'Cause I'm-
flutters, the
Yes.
butterflies,
But
and then you get to the I'm gonna karate kick you
Oh,
right in the gut.
that or all of a sudden your body just completely shifts. Like
Yeah.
you watch your stomach go from angling to the left to angling to the right, and you're like, "What's going on?"
And those were
so-
lovely times. I mean,
Yes.
I wouldn't give up my children for the world. I
Yeah.
would have them all over again.
100%,
I would.
100%.
I really would. And the thing is, you don't forget the pain.
Right, but I
but-
would do that again.
The outcome was worth all the pain you go through,
Yeah,
even when they're little turds when they're 2 and 3. But now that you know I've reached the again, because after momhood, you're not a girl anymore. You're just mom.
Your mom.
And now that I've reached 50, over 50,
Yep.
you know, I think God just said, I'm just kidding. We're going to add some more stuff on there just for funsies. Just for funsies. So, yeah, perimenopause, menopause,
Yep.
post menopause. Because evidently there's a post after you're done.
I didn't sign up for the pre,
Me
but-
neither.
but I've been doing it according to my physician. I have been in perimenopause,
Mm-hmm.
premenopause. I've been doing that since 2020. So the year COVID came, perimenopause came. It's been great.
Nice.
And so for 6 years now, but I've started a new thing, which is why I'm putting my hands in my hoodie and stuff. I didn't know that there were cold flashes, which is now that my new thing. Like I did hot ones for 5 years and now I'm doing cold ones. Like my feet are freezing, my hands are cold, whereas before it would be 20 degrees outside. I'd go out in a tank top and be okay. Now I'm like, I need a coat. Where's my jacket?
Right. And did the doctors ask you questions like my doctor? Well, what age was your mom? Well, my mom went through menopause or whatever at like 35 because she had a hysterectomy.
Because that's how physicians took care of things in our parents' era.
Right.
Because they would every one of the women on my mom's side of the family had a hysterectomy in their 30s. Because things start going weird. Things, are, not happening as normally as they had been.
It'll be fine.
So we'll fix it. We'll just gut that sucker and move on. And so I had no perspective. So one of the things that I also had to do was I have to go to regular doctor's appointments because they also didn't do that back then either.
Right.
To track things Eliana will ask me questions because I've been very open with her because I had a lack of knowledge coming up because mom's a little Southern conservative and didn't share everything. Or it was done in, birds and bees. I don't know what birds are that doesn't help me at all.
Do birds get hot flashes and
I
cold
guess.
flashes?
I don't know. Maybe that's why they molt. So I don't know.
Maybe. Yeah, maybe.
That's just the girl birds having hot flashes.
Right.
They're molting.
Right.
So, but so I track things and I try to keep more records of things to tell her. And so, and my son, because he's going to have to deal with a girl things at some point in time. So he's the one boy that I know in life that I'll tell him, hey, I need you to go to the store and pick up the Always, this color, this thing, he's like, all right. And he has no problem doing any of that because we have been very open about all the things with both of them. So that way they're not ignorant of things. And sometimes I think that both of my kids are like, okay, seriously, we get it. Enough. Quit talking about all the stuff. Because I was, I think, overcompensating for my lack of information. And
I don't think they need to know everything.
Well,
they don't need to know everything.
Well, no. Well, but
maybe parts, but not everything.
But knowing that there's, this pre thing. I didn't know there was a post thing, so now I got to Google that.
Post thing. I don't know what that. I haven't looked into that. I'm just, there for a while. I thought, okay. Because I was having I'd get really hot.
Yeah.
Walk around in tank tops all the time. I was cool. It was great. I got really hot. Not as hot as you got though. I never broke out into mad sweats.
I would visually sweat. My hair was wet and stuff in church and everything. I'm like, no, church was good, but it wasn't flipping, jumping up and down, sweating my face off good. That was just God. I get maybe it is church. It's God trying to give me perimenopause. It's God's fault, I guess.
It.
So
that's what it is.
Yeah, that's what it is. Oh.
Yeah, but I started that and I thought, oh, it's stress, it's whatever.
Yeah.
No. Yeah.
But
now I never knew that things could hurt for no apparent reason.
Or itch.
My teeth hurt. Why do my teeth hurt?
My ear itches every once in a while. Which I found out that's a thing.
Yeah.
The muscle pain
and
stuff. Just I thought that I was past all that. I did that at the early onset of becoming a girl, and it all comes back.
It does.
Weird things. So
parts of your body getting cold. Like my hand is cold right now. Like my hands.
Yeah. Oh, my
Nothing
hands are
else.
my hands
Just
are
my
freezing.
hands.
My hands and feet are freezing. But
No, my feet are fine.
but
This is
one of the
just my hands.
one of the other things, as you get older, it also becomes harder to lose weight, right?
Yes.
So, and guess what? When you hit the perimenopause, it's also harder to lose weight. The gaining,
Now
good to go.
I will tell you, I lost weight in one area, gained it in another.
Yeah.
Don't really know how that works.
The weight shifting.
I guess. And then the other day I went into work, right? I went into work and get up and do the same thing I do every morning. Right? Well, kind of. I didn't have to straighten my hair as much. I go into work and my coworker's like, "Oh, I love what you've done with your hair." I'm like, "Thanks, it's gray." Because I'm turning silver. And I'm like, I guess I'm going to have to dye it. And I'm like, nah, we're just going to go with it because it still looks blonde right now. So it's fine.
Yeah.
But she's like, no, I love how you straightened it. And I was like, oh, I didn't straighten it. It just turned out this way. And she's like, what? I'm like, yeah, I just woke up one morning and my hair decided it was going to be straight.
And not wavy, how it's been.
Not wavy.
Since forever.
Yeah. My entire life, my hair has been wavy.
Yeah.
And it is now, I mean, I would have to get up and straighten it in order to get it to lay straight. Nope.
Yeah.
Now I just get up and it turns out straight.
That's another perimenopause thing is
like,
that
what in the world?
Not only does your hair fall out, but it also, can change texture. It can change. And because I went from having poker straight hair to having wavy curly hair after the second baby. And then I was like, okay, figuring out all the curly wavy and kind of found somebody to help me get it cut so that it would work right and stuff. And then in the last 2 years, it's gone back to straight. And then I'm like, wait, no, I got to used to, and I like to having the curly wavy hair. And so I went and got a perm. And then she informed me that it was going to strip out probably any of the hair color that I had. And then I couldn't do anything. Like, as I'm like, she's putting the solution on my head. And she's like, oh, and by the way, when you're going through menopause too, this may take or it may not take. Okay, cool. And then the other thing about it is that she's like, and you can't put any hair dye on it for like at least 2 weeks.
Oh my gosh.
So hence the reason I had like gray halo for a while. So
well, I'm just going to embrace it. I'm going to embrace the silver.
Yes, but
and see how it turns out.
Yours looks really good. I had like a beanie on my head of gray hair. Not as attractive. So
you didn't want to have.
I didn't want the gray beanie. I could put a propeller on my head and then I look super cute.
It looked like a hat.
But yet again, back to, I'm not a little kid anymore and that just looks weird. Now if we start wearing that stuff though, too, like back to the tutus.
Yeah.
If we start doing it now, maybe we would just be considered what is it? I can't say that.
Eccentric.
Thank you. That word.
Maybe we should go with that.
I know, right? Because I enjoy wearing, fun, cutesy stuff. And my kids have gotten used to over the years that I realized at one point in time, like, why is it okay for little kids to dance and it's cute and fun? But as an adult, if you go in the store and they start playing your jam, if you start dancing, people are like, what is wrong with them?
Or singing it.
Right. Yeah.
I know.
So I decided that I was just going to do that. And so their whole life, they're not shocked or surprised at all if I start dancing or singing with anything. And when we went on vacation a couple of years ago, went to Gatlinburg, walked into the Mexican restaurant we were going to eat at, and I started dancing, and my mom did the thing. What in the world are you doing? You're an adult. And I'm like, which means I can do whatever I want. And I just went on dancing. Right. And I'm like, as an adult, I can make that choice to dance because it's not inappropriate.
And you know what one of the best things about being in perimenopause is? You can blame it on brain fog.
Oh,
I don't remember doing that. I don't know what you're talking about.
I don't know what you're talking about at all.
Yeah, I didn't do that. I don't know what you're talking about.
Today I totally had that. We were in a meeting. I had been working on something, logged into the meeting, started doing the meeting thing. And then as I'm sitting there and, we get done, we say our goodbyes and stuff. I sat and I looked at my computer and went, oh, what was I doing with this file? So I had to reboot my brain.
I'm telling you.
I'm like, okay, I'm going to get up, go fill my water bottle because I drank it through the meeting. I'm going to go fill my water bottle and come back. And then literally it took me just that little bit of time to step away. And I came back and I was like, I remember what I was doing now. I'm like, Good Lord. And if
And-
my boss sees this, I totally did what I was supposed to do. It's done. Okay. So
May have been a little longer than anticipated,
yeah,
but I did it.
It took enough to fill a water bottle. It's fine.
Right.
It's
It's
fine.
fine. It's fine. Well, and then you thought, I thought, okay, we're going into perimenopause, premenopause,
Yeah.
early menopause, whatever they want
Yeah.
to call it. They call it all different kinds
Yeah,
of
all
things.
different kinds of things.
I don't know about you, but I thought, oh, cool. That means no more menstrual cycle.
Yeah, no, that's
No more ant flow. Nope. It fools you.
Yeah.
It fools you. You like go and you're like, ha, I'm finished. Woo!
Yeah, you go 2-3 months nothing,
Mhm.
and then
And then it comes back like a vengeance.
uh-huh.
And honestly, I'm gonna be honest. I thought, oh my goodness, I'm dying. I'm gonna bleed out. That's just the end of it. It's gonna be the end of it. That we're all done.
Yeah. Yeah. Oh, I feel you. I went to the doctor and the doctor said, well, we can do some things like you can do dietary changes, drink more water. I don't know why water is a solution for everything.
You're
So
hydrated.
I guess. I
You're
don't know.
hydrated.
So
So
drink
keep
more
it hydrated,
water.
people.
Right. Water bottles. Bring your sippy cups. So drink water. If you lose weight loss and water fixes all things.
Uh-huh.
And then
But you
or-
can't lose weight as easy.
no. Or the other
Mm.
solution was
Yeah.
hysterectomy.
Well,
We just,
take it out.
get the melon baller, scoop it out, and we're all done.
Oh my god. Well, I mean, hey,
Do what you gotta do.
I guess.
So,
I guess.
so I have done the drink more water and be more. Oh, she also said we could do like birth control, and I'm like, well, I'm not married, I'm the widow, so, I choose, like, to me, for my life, if I'm not married, that means that I'm celibate, so I don't need birth control for that reason, and my acne seems to be doing okay, and so, and I'm like, so what's that gonna give me? And she's like, well, you just gotta remember these can cause weight gain. I'm like, stop, like, we'll just hydrate, try to lose weight, and
Everything causes
deal with
weight
it.
gain.
yeah,
Everything causes weight
Yeah.
gain. I can look at something and it's going to cause weight gain.
right? It's like, cake. Ah, dang it.
I know. It's terrible.
But
It's terrible.
and my doctor also didn't think initially that I had started that because I was too young,
Right?
and so
Too young.
did some blood tests.
Just kidding.
Yeah, just kidding. So we're 6 years in. Can last up to 10.
Oh, that's nice.
Yeah, that was fun fact.
That's nice.
And I'm like, can it go more than 10? She's like, well, I'm like, so yes, it can, I guess, because it is what it is. It goes however long it goes. And so we're just riding the wave. I have a little portable fan that I carry with me that at times I share with other people around and stuff when I have the hot flashes. So here in the last little bit,
And now you're going to start carrying a blanket
I'm
for when
gonna
you
have
get
to-
to
I
cold
know.
flashes.
I have become like hoodie woman. I have multiple hoodies because I can put my hands in my pocket because my hands are freezing. The other day, I'm like, I need thicker socks on. My feet are cold. So
My goodness. And see, I don't know about you, but I was not prepared at all.
no,
Not prepared. I'm still not prepared.
no,
I have no idea what's going to happen next.
no. And we'll keep you informed as to what happens next. But
No
This-
idea.
this whole thing, like, I didn't know. Well, and I just thought, honestly, I thought I was losing my mind because of the brain fog, because I didn't know that was a thing. Because the
Right.
doctor didn't tell me all the things. And then we know better than the Google things, because it can be anything from an aneurysm
You'd end
till
up
you're
with a
already
brain-
dead.
you'd end up with a
Like,
brain tumor.
right,
It's a brain tumor.
right. It's a tumor. So, I didn't want to Google stuff, but then I started like, okay, am I crazy? Like, my ears keep itching
Yes.
all the time. Like, and I'm like, they're clean. I am thinking I have to clean my ears, but it's not the inside that's itching. So it was all weird. And then, things started hurting. Then I'm like, I know I didn't work out because I don't work out. So, like, why does that hurt? So, like, why is that sore?
Because we don't work out.
Yeah, I didn't work out.
We don't work out.
Hence, it's probably why there's weight gain. But, don't judge.
No, I've
Um,
heard it. I've heard that some people go to the gym regularly and they're still gaining weight
Yeah. Oh, yeah.
because it's a thing.
Yeah. I just,
It's a thing. So yeah, I think if I was going to complain, which I'm not, But if I was going to complain to God, which I'm not, I think he was a little harsh. I think the punishment doesn't really fit the crime. I'm just saying. I think,
offering fruit should
I mean,
not have led to
Adam went along with it. He should have got equal punishment. I'm just saying. Because what do men get? They grow, they get gray, and they get more distinguished unless you're just weird and you fall apart.
Or you could look at it, it's the fact that they have to deal with us, and that's like that's part of the punishment. It's like, oh yeah,
Maybe.
see, this is like twofold. You know, you want to be with a woman, you got to deal with her mess too.
Maybe,
So
maybe that's it.
and and then in the Bible it does say that the husband or the man, the head of the household, is supposed to treat the spouse as Christ would treat the church, which means doing everything it can to care for, provide for.
So bring
right?
me your blanket.
Yeah.
Your fan.
Bring me my fan and my blanket at the same time because my head's sweating, my hands are freezing. So, hey, and it happens. It fully happens all the time.
I know.
Yeah.
Last night I woke up, I was hot. So I flipped the blanket off.
Yeah.
And then I'm like, my feet are cold. So I had to stick my feet back underneath the blanket.
Yeah.
But the rest of my body was out.
Yeah. So I used to have, Travis and I had talked about this. We had a theory that, we talked about whether or not, are you fully covered with a blanket or do you have to have a leg out or something? Because if you have your leg out, the fake ghosts and goblins can get you. So, but if you're completely covered up in the blanket, nobody can get you.
I don't think that's really true.
I don't think that's really true either. But the more I progressed in the hot flashiness,
they're just going to get you, aren't they?
Oh, come at me, bro. Come at me. Because I'm also angry at times for no apparent reason. I'm usually a very pleasant person. And then there's other times where I'm just like, oh, you have a head? I'm going to rip it off. Like, that's what we're going to do right now.
I don't think I get that way.
Oh.
But then again, I don't know. Maybe I do. Maybe in my mind, I'm perfectly sane and fine.
Yeah. No, I have 2 children that I've informed them, like, if my temperament goes wonky one way or another, give me a heads up. And yeah, daughter has definitely shared, hey, Mom, you could probably dial it down a little. Like, she says it very gently, not knowing.
You know what? Now that I think about it, the one that lives with me,
yeah,
he'll be like, why so aggressive, dude? And I just
See?
thought I was being like, because I go without talking to people sometimes because I'll be the only one home. So he'll come home and I'll go to talk to him and he'll be like, why are you so aggressive? So maybe
that's what it is.
He's very sweet.
He is. Yeah.
He's very sweet. He would never tell me like, why are you so mad? Why are you yelling at me? He would be all...
the older ones for both of us would be like, why so angry?
Right. He's
Our
the
younger
same
ones
kid
are a
that when
little
I
bit
put stuff on
softer.
and say, how does this look? And he's like, do you feel good in it?
And that means don't wear it.
Right.
Yeah.
So I've changed it to, do it look like a stuffed sausage?
Yeah.
And that's a yes or no answer. So are there parts sticking out that aren't supposed to stick out?
Kielbasa, no kielbasa.
Maybe. I don't know. I think the only time he's ever told me something didn't look good he's done it twice.
Yeah.
The one time he said, that's too old for you. And I looked at him, I said, what does that mean? He's like, you look like Little House on the Prairie. It's not a good look. I'm like, oh, okay. And then the other time was when he said, oh, that's a nice outfit. Mama would have wore that.
Yeah.
So we gave that away.
Yeah.
Yeah, immediately. Like we took it off, put it in a bag, and we gave it away.
Yeah. Yeah.
That was the thing.
Yep.
Yeah.
Been there, done
so,
that.
I mean, think of all the fun stuff we have to look forward to as we progress in our old age.
And we can continue to talk about.
Yeah.
So there will be more.
The joys of being a woman.
Right?
Or the lack of joy. Whatever the case. The angry women.
I enjoy being a girl.
I do too.
Because you can pony and baseball hat, or you can, sparkles and go. But
right?
And now tutus, bringing them back.
That's right.
So
I said I should have been a hippie. I should just be wearing around hippie stuff. That would suit me just fine. I think that's going to be all for today. We're going to wrap it up for our day, for our talk of the joys of being a woman.
Yep.
I look forward to our future podcasts. I hope you do too. I think we're going to work on maybe documenting one of our trips out together and what adventures we can get into that way.
Or misadventures.
Yeah, maybe. You never know. I don't know. Maybe we'll have special guests for that. I've got some stories about misadventures.
Oh, yes. Yes, you do.
I do. I do. All right. Well, thanks for joining us.
And we'll see you next time.
Bye.